Gordon Ramsay just showed the world something more important than any recipe, and it just might save your life. Now, we're used to Gordon roasting people in the kitchen, but this time he got roasted by the sun and recently posted on Instagram that he developed and was treated for a basal cell carcinoma, the most common type of skin cancer. The problem is that most people just ignore spots on their skin and let it go way too long until the results might be catastrophic. And keep in mind that skin cancer rates are skyrocketing all across the world right now. So what can we learn from Gordon's diagnosis and treatment of this skin cancer? That information just might save you or a family member, and by the end of this video, you're gonna know exactly what to look for when it comes to skin cancer, particularly basal cell carcinoma. As I teased earlier in the video, we can see this photo where Gordon is showing the bandage that was placed on his skin after having treatment for his skin cancer. We can also see here what the stitches look like, and thankfully this is not a huge incision, so the cancer likely was caught fairly early. Now, Gordon Ramsay is not the only celebrity that has faced a skin cancer diagnosis. We've talked on this channel about other celebrities like Hugh Jackman, Khloe Kardashian, and Nick Jonas, who have all had their own encounters with skin cancer and posted about them on social media. When celebrities like Gordon Ramsay post about their health struggles, particularly skin cancer, it helps to destigmatize the condition and encourage people to go and get their skin checked. And as well, in this video, I'm going to teach you how to identify those things early and adopt the behaviors that will decrease your risk of developing skin cancer. But one thing you need to know before we go any further is that there is something out there called the illness industrial complex. It is this nebulous thing, but ultimately it's any entity or individual that wants to deceive you when it comes to your health. The most important thing you can do is understand the facts and make the most informed decision for you, your family, and your health. That's what I try to do on this channel, is to empower you in your health journey. And if that's something you're interested in, make sure you hit that subscribe button. To help you understand a little bit about basal cell carcinoma, you need to know what they look like and where they tend to appear. Now, basal cell carcinomas will most commonly show up in sun-exposed areas because they are caused by chronic sun exposure. The more sun that you get over the course of your lifetime, the higher the risk that you will have of developing a basal cell carcinoma. Now, there's other factors, obviously, that play into getting skin cancer. If you are fair-skinned, if you have red or blonde hair, light-colored eyes, these are all the scenario in which a basal cell carcinoma can more easily develop because you don't have as much melanin in your skin to protect you. Gordon Ramsay is the poster child for this, being very fair-skinned, and he does spend a lot of time outdoors when he's not in the kitchen. It is not uncommon for a basal cell carcinoma to appear in areas we can't see very well, and in this case for Gordon Ramsay, right below the ear is probably not something that frequently caught his eye when he was looking in the mirror, because it's kind of hidden there, and this is a location that I see all of the time in my clinic. Now, other common areas for basal cell carcinoma to develop would be on the nose, on the ears themselves, the neck, or really anywhere on the face. So the location that has developed is very common, that I see all the time in my clinic. Basal cell carcinomas can be tricky because sometimes they can look like a whole lot of nothing. When we talk about doing self-skin checks, oftentimes we talk about the ABCDE rules, which primarily follow melanoma. It's how to spot when a mole has turned bad, but the basal cell carcinoma doesn't always follow those rules. So the main things that you want to look for are often a shiny, or we call it a pearly papule on the skin. They can be a small bump that are usually going to be flesh colored, and they might be somewhat reflective or shiny as they develop. And I've shown a couple of pictures here so you can get an idea of what they look like. They often will have little blood vessels growing on top of them, and that can be a telltale sign for a dermatologist like myself to diagnose them early while they're still very small. Anytime a celebrity announces that they've had a skin cancer, I like to go back through their social media posts and see if I can spot the skin cancer months or years before. I've done this with Hugh Jackman, I looked on Khloe Kardashian's, and even Nick Jonas's photos. When we look at Gordon Ramsay's photos, the best example that I could find is when he was competing in a half Ironman triathlon. You can see as he's standing here with his wife that there is a spot just under his left ear, and it actually looks ulcerated in this case, meaning that the top of it has come off and it may have bled from time to time. The thing that I don't know is if this had already been biopsied at that point and it was trying to heal and that's what made it look ulcerated. When we zoom in closer, you can see in a little bit better detail about the size of the spot. It's not huge, but it's not small either. It's definitely visible to the naked eye. When a basal cell carcinoma appears, it might bleed easily, and this is a telltale sign that you know you should get something checked. Some people will come into my clinic and say, I thought it was just a pimple that hadn't gone away. So if you have something that bleeds easily, or it looks like a pimple and it's been there for 2 months, you definitely should get that checked out by a board-certified dermatologist. Many people take the wait and see approach when they get something new on their skin, and that's certainly the wrong thing to do. Now, I don't know how long this spot might have been there on Gordon Ramsay's skin, but we know it didn't get too big based on the photos that we can see, and he did the right thing by going and getting it treated. Now, he doesn't specifically say if he had Mohs surgery, but he does call out Skin Associates as the clinic he went to have this treated, and it looks like they did a good job based on the photos that he's provided. By getting it treated when it's at this stage, he saved himself from a much bigger problem, because when a basal cell carcinoma is allowed to grow, even though they don't metastasize inside the body, they can become a huge problem. And just a warning, this next photo is a little bit more graphic than the other. A basal cell carcinoma can develop on critical structures, and in this case, right near the eyelid. Removing this will lead to reconstructive surgery to make sure that the eyelid not only looks good, but still functions as an eyelid should. And I've taken off huge basal cell carcinomas from people who waited way too long to go and get them treated, and they have to undergo major reconstructive surgery that sometimes takes 2 or 3 surgical procedures to get them back to where they should be. So what did Gordon Ramsay do right in this situation? Well, first off, he didn't ignore it. Again, we don't know how long it had been there, but he did get it treated at a relatively early stage, and this saved him from having a bigger scar than he otherwise would. Based on the size and the location of this scar, 6 months from now, this is going to be almost imperceptible. He probably won't even notice it unless he looks super close, and anybody that doesn't know that he had a skin cancer probably won't be able to tell. The other thing that he did right is he shared his story, and I love when celebrities do this because, as I said, it does break the stigma and help encourage people to get spots on their skin checked so they don't neglect it and run into a much bigger problem, even one that could risk their life. Now that you know all of this, what should your action plan be? Well, the first thing that you can do are monthly skin checks at home. Get in your birthday suit and look all over your skin. Look at your face, your arms, get a mirror and look at your backside. If you need help, have somebody use a phone to take photos of areas of your skin like your back. Just make sure that you do it under the same lighting conditions, hold the phone the same distance away from the skin so that you can create an album on your phone that you scroll through and see if anything new has popped up or changed in a month. If you see something that you're worried about, the next thing is go see a board-certified dermatologist and have that spot properly evaluated. Dermatologists use tools like a dermatoscope to look at things with magnification under polarized light to make sure that we catch them at the earliest stage possible. Don't play the waiting game or the wait and see approach because it could lead to bigger problems down the road. If it is a melanoma, it could risk your life. If it's a basal cell, it could lead to a much bigger surgery with a longer recovery and the increased potential for complications. And lastly, I encourage you to find a dermatologist now. That doesn't mean that you have to go get your skin checked next week, but it's a good idea if you have risk factors for skin cancer or you've had a family member that's had a skin cancer to go get a baseline skin exam, get established at an office so that if you do notice something you're concerned about, it's going to be easier to get in for that next appointment. And lastly, don't let fear-mongering scare you into not doing your skin checks or not seeing a dermatologist, because again, when it's caught early, it is very treatable in almost every single case. There's a lot of people advocating that you don't use sunscreen or that you go and get more sun exposure than you probably should. The sun can have great health benefits, but it also can put your skin at risk, and it's important to have balance. Take a page out of Gordon Ramsay's playbook or recipe book, if you will, and empower yourself to take control of your health. Get things checked early, and if you guys like videos like these and would like to see more of them, hit that subscribe button and tell me what you'd like to see in the comments, and I'll catch you guys on the next video.